Republicans are blasting party leadership for sending members home without voting to address Obamacare first. This is a decision that will force millions of Americans to be uninsured, to go without insurance, or to pay a lot more for higher insurance premiums, with those enhanced subsidies expiring next week. But some GOP centrists are signing on to a Democratic push to force a vote on extending the subsidies when Congress reconvenes.
It's Ken Harbaugh with the MeidasTouch Network. Healthcare premiums are about to skyrocket, if they haven't already, for millions of Americans because Republicans refuse to extend the Affordable Care Act subsidies. Some Republican lawmakers have felt the pressure and are siding with Dems, but the Republican Party has spent 15 years complaining about the ACA, Obamacare, and done nothing. Donald Trump's imaginary, beautiful healthcare bill is a couple weeks away, and it always will be, because the Republican Party is not about solutions, it's about grievance. Here's Donald Trump lying as usual about the ACA and his party's plan to address it.
Well, the Unaffordable Care Act, which is Obamacare, they call it now the unaffordable because it's unaffordable. It used to be called the affordable, but it was never affordable. It was always bad. It was basically designed for the benefit of insurance companies. And what we're doing is we want all of the billions and billions of dollars that went to insurance companies to go directly to the people, and they can buy their own health care. And people love it.
People do not love it, which is why even some Republicans are defecting to the Democrats on this. What Donald Trump is proposing would raise premiums, undermine Medicare, and most importantly, it would gut coverage for pre-existing conditions. The whole point of insurance of any kind is to distribute risk so that when a need or a crisis hits, the burden isn't carried alone. This generational battle over healthcare has been incredibly frustrating for Americans caught in the middle, as my family has been, but it has at least illuminated the Republican philosophy of government. It's survival of the fittest, or rugged individualism, as they like to say. But when you've got a sick kid or a pre-existing condition, that doesn't work. And it turns out most Americans don't want to live in a country that thinks like that. I wanted to talk to someone on the front lines of this fight. Jocelyn Benson is running for governor of Michigan, and everywhere she goes, healthcare is top of mind. Americans are worried, they're fed up, and they don't trust the system. It's going to be up to a new generation of Democratic leaders like Jocelyn to defend the progress that we have made, the ACA in particular, and to continue to push for the kinds of healthcare reforms that will benefit all Americans. Here's our conversation. Jocelyn, welcome to the show. Healthcare has got to be top of mind wherever you're in the state talking to constituents as Secretary of State and as their potential next governor. I've got my own horror stories, which, I might share, but what are you hearing out there on the campaign trail?
First, thanks for having me. Really excited to be here. And as I travel the state of Michigan, asking for folks' support and partnership in my campaign for governor here, the number one thing I hear about is healthcare affordability and real fears and anxieties in nearly every conversation, every stop that I have along the trail, real anxieties that families are either struggling with healthcare or one catastrophic illness or injury away from bankruptcy because of rising healthcare costs in a system that too often puts profits before people. And there's a lot that the state, I believe, can do to alleviate a lot of those concerns. But it makes my blood boil. One of the things I do, I'm a runner. And so about once a month, I go on a run with like a neighborhood run group. And I went on one in Detroit, and this woman came up to me and she was running alongside me. And she said, I'm a conservative voter. I voted for Trump. My family's conservative. We've always voted Republican. And I just want you to hear my story. And I said, okay. And she said, up in Traverse City, which is sort of a northern area of our state, my dad worked in carpentry his whole life. And every month he paid into his own healthcare system, $1,000 a month. And then he had a heart attack, and the insurance company wouldn't cover the healthcare he needed to both recover and build sort of a healthier lifestyle after that, to ensure he didn't have another heart attack. And after fighting the insurance company for coverage for months, he actually eventually passed away because he couldn't get the coverage that he needed to ensure that the system he was paying into helped restore his health after that heart attack. And she said, I feel like no one cares. I called the Department of Health and Human Services. They wouldn't return my calls. All we needed was help navigating this maze of insurance, and no one could give it to us. And it stuck with me because it reinforced how this is life and death, literally life and death. And I'm running against people who have actively voted to cut Medicaid, right, along with the Trump agenda. And at the same time, their voters are dealing with these life and death situations, losing their lives because they can't ensure the system that they've been a part of paying into is going to be there when they need it. And that's why, in my view, the healthcare system is failing in so many ways. It is unaffordable for far too many, and it is inaccessible. And oftentimes getting quality healthcare, especially in the rural areas of our state, is a non-starter for folks. And so it's top of mind for me. And that's just one of dozens of stories that are all gut-wrenching and all just emphasize that what are we doing as a government, as a society, if we're not taking care of each other and ensuring those basic needs, those basic healthcare needs are met, especially for those folks who pay into the system and do everything right.
Yeah. I feel like that maze of insurance, as you described it, is by design. I am no longer convinced that it is an artifact of the labyrinthine system we have. It feels like the insurance companies use it to their benefit. And
profits over people. Yeah, absolutely.
And the idea that it is so hard to navigate that some people just give up. I mentioned to my wife this morning that we were going to have this conversation, and I asked her about our recent horror stories. I mean, our healthcare insurance horror stories go back 16 years to when my second daughter was born, and she needed this series of surgeries, and trying to get her through that was damn near impossible. But, Anne Marie, I could see her tense up, and she said, "How much time do we have?" And I said, 10 minutes. We're about to hop on. But the latest was a shoulder injury that she had. The doctor requested an x-ray, $1,500 for that x-ray. And our solution as a family was, well, we just won't take the appointment. Hey everyone, it's Ken. Quick break for a shameless pitch for my Substack and Patreon pages. To all of you who have subscribed, thank you. Your support is what makes this show possible. Anytime you see in-person reporting, whether it's trips to Ukraine to show you what is really happening on the ground, or my recent conversations with Congressman Jason Crow and Senator Tammy Duckworth, where we got on-the-record commitments to back hearings into ICE's abuses of power.
People need to know that we're taking names.
All of this only happens with your support. Every dollar that comes in through Substack and Patreon goes back into this show. And with the holidays coming up, you can give gift subscriptions as well. The links are below. Thanks for everything. Your support means the world to me. Back to the show. I imagine that happens more often than not, that the insurance companies throws up this barrier trying to break people into not getting health care. And it works because I know the insurance companies are getting richer and Americans are getting sicker.
Yeah. And it's affecting all of us because the decline in health overall, and when you combine that with the nonsensical leadership on health we're seeing at the national level, it's taking away the protections for vaccines and other things that have been in place for decades that are research driven. It's creating a less healthy society and an unaffordable one for everyone. And just yesterday, I spoke to someone who's a family of two. Their combined income is just under $200,000, about $180,000, and their healthcare premiums are about to be next year $40,000 a month, right? And one member of the couple has cancer. And so they need healthcare coverage to go through the treatment. And it is going to wipe them clean. They're going to have such little funds on the other side of it. And again, it is the result of a broken system. And so one of the things I want to do as governor, I oversee right now our second largest department, the Department of Motor Vehicles. Makes you very popular. Everyone loves going to the DMV. But we've actually been able to fix it to eliminate wait times and ensure that the government's actually working well. There's no wait. You can get in and out of our offices in 20 minutes or less. We have self-service stations at grocery stores, mobile offices that show up at senior centers and schools to help get people IDs and the like. And so the largest department in Michigan is our Department of Health and Human Services. And I really want to ensure that it's as easy to get access to healthcare as it is to get your driver's license in Michigan. And we can do that by ensuring, among other things, that we require insurance agencies to employ and consider doctors and physicians in making their determinations. And also we can assist residents of Michigan with their appeals to healthcare decisions. There's a great startup company actually in northern Michigan, in Marquette, in the Upper Peninsula, that's actually helping residents using technology to enable them to navigate that maze of insurance decisions more easily. And if the state is doing that, if our Department of Health and Human Services is able to do that for residents who need that helping hand, it's a great way to help navigate these challenges and make life a little bit easier, make healthcare a little bit more affordable when people are struggling right now.
That was part 1 of my conversation with Jocelyn Benson. Check out part 2 on Wednesday, where we talk about what governors can do to hold insurance companies accountable. For tomorrow, I've got America's former ambassador to Ukraine, Bridget Brink. See you then.
Love this video? Support independent media and unlock exclusive content, ad-free videos, and custom emojis by becoming a paid member of our YouTube channel today. You can also gift memberships to others. Let's keep growing together.